Hello everyone. Assalamu alaikum. You are all welcome to yet another interesting presentation, or I can say seminar under the auspice of Gamji Educational and Mentorship Forum happening today, Saturday, 8th of November at 8 p.m. to 9 p.m. Roughly, that's the time we're going to be taking, and this is West African time. My name is Umar Muhammad Bello, and I'll be the host for the program today. I can see so many people are joining as we go through the introduction, which is quite nice. So I would like to thank you, the audience, for taking your precious Saturday to attend this session. As we shared in the pamphlet, that the title of the program is Insights into the National Health Fellowship Program, which is a program which is domiciled in the sector-wide approach, or SWAP, which is to this topic. We are privileged and honored to have Dr. Ashiru Adamu Abubakar, who is going to be our presenter today. So Dr. Ashiru is the technical assistant to the coordinating Minister of Health and Social Welfare on SWAP governance. So thank you so much, Doctor, for taking your time to be with us today. Before we get to into the program proper, let me give us a brief bio of the presenter for today. All right. Okay, perfect. So Dr. Ashiru serves as technical assistant to the coordinating Minister of Health and Social Welfare on SWAP governance coordination and the state engagement at the SWAP coordination office. With 15 years of experience in clinical practice, government, community relationships, or community relations, budget monitoring, and project management, he brings a wealth of knowledge to this role. In terms of his education, he holds a bachelor's degree and a bachelor's of medicine and a bachelor's of surgery from Bayero University, Kano, along with dual master's degree in health management, planning and policy, and health economics from the University of Leeds here in the UK and Bayero University, Kano, respectively. Before his present role, he was the program manager for the PHC Sustainable Health Finance and Health System Strengthening Programs with the Clinton Health Access Initiative. In his current role, Dr. Ashiru utilizes his expertise in government and development to promote the adaptation of the SWAP principles at the subnational level in Nigeria, while also coordinating efforts to ensure the sustainability of these reforms. So Dr. Ashiru is a maternal health Young Champions Fellow for Harvard School of Public Health. He was honored as Nigeria's maternal and newborn hero in 2013 and is a 2014 Mandela Washington Fellow in the Civic Leadership track. Additionally, he is a recipient of the prestigious Chevening Scholarship here in the United Kingdom. So thank you so much, Doctor, for being with us today and for actually talking on this very important program, especially for the young people aspiring to to go into healthcare, especially at the primary care level. So the format of the program is Doctor is going to give us a talk and then maybe for around 20 minutes. And after that, we are going to open the session for Q&A. So if you have any questions, you can actually draft the question through the chat box, or you can actually raise your hand during the Q&A session, and we can be able to then take some questions depending on the time. So thank you so much, Doctor, for being with us, and the time is back to you, Doctor.
So good morning, good afternoon, good evening, participant, depending on, on where you are joining the conversation from. Thank you so much, Umar, for the kind words and introduction. And within the next couple of minutes, I will attempt to share with us what the National Health Fellowship Program is all about and some to telling people, I mean, to getting into the application process. Because one thing is for sure, if you don't know what you are in for, you may not necessarily sit down to put in the effort necessary to get to get accepted. So we intend to socialize what the first cohort have been doing, what the process was for getting the first cohort, and as a precursor to that, and then to now take on the conversation on the second cohort. I have some slide deck. I will quickly run through them. So just to start, last year, April 8th, Mr. President Bola Ahmed Tinubu made this announcement that he approved for the establishment of the National Health Fellows Program to be domiciled at the SWAP Coordination Office. The fellows, as the President mentioned then, be trained and they will serve as fiduciary agent to monitor and track primary healthcare development and performance. And then that program is expected to be the pipeline project for building new leaders in the health sector. And so for us at the SWAP Coordination Office, we are operating under the Office of the Honorable Coordinating Minister of Health and Social Welfare. And so we had to sit down to x-ray what truly does this mean, the directive of Mr. President. And we felt it's important for us to we understood the lopsidedness in how development specialists are distributed across the country, and largely have maybe pockets of them, but we do not have universality of their presence across all the local governments. And then we felt it's important, especially as guided by the Honorable Minister, that by us targeting well-motivated young Nigerians to play their role in the health sector, we are really strengthening Nigeria's health system to improve overall population health outcomes. And we did have the thought that once this is well done, and we have fellows that are altruistically motivated to contribute to the development of the health system and the country at large, the health fellows will be the missing link between the community and the country's primary healthcare system, thereby catalyzing a lot of the action to drive accountability, ownership, and improve health outcomes. We sat down, please can we ensure we mute, please? We sat down to x-ray the full length of processes that needs to happen to make sure that we get that positive outcome that we're really looking forward to, of having fellows that will be the future leaders within the country. And we x-ray multi-stages from the recruitment, the training, to the end, right? And in terms of the selection criteria, we felt the fellowship is really targeting early career starters within the health sector, and understanding very carefully that development, public health and health development sector is a skill. What you need is to get yourself in tune with the thinking process, how to work towards addressing issues and advancing and improving the lives and well-beings of people. Once you are able to get those skills, then you are able to accelerate that conversation. And accordingly, the Honorable Minister now directed that while this is health, National Health Fellowship Program, but the selection criteria is not only limited to health, because we now understood very carefully that there is a lot of value that others that are outside the health sector can play in accelerating improvement in the health sector. And accordingly, we've now rested on identifying those eligible candidates that have background in health and health-related information technology, social sciences, accounting, among others. And we want people that have demonstrable interest or experience in primary healthcare or health-related NGOs, and individuals that have demonstrated some analytical skills. Can we please mute the new entrants? Thank you. In terms of requirement, we are really looking forward for fellows that are individuals that are between 25 to 35 years of age, that preferably are not presently engaged, or would have commitment to be available for full time within the 1 year. Please, can we mute, please?
Hello, sorry, doctor. Please mute yourself when you comment. Thank you. Sorry, doctor. Go ahead, please.
And to make sure that we are balancing the demographics, we are ensuring that we are covering all persons. So we ensure the directive of Mr. President is to have at least one fellow per local government. And so we felt to balance it, we want to make sure that each local government gets represented so that if that person becomes an icon, that local government can go back to celebrate that we have a star within our community. So literally that's sort of what we'll be looking out for in the health fellows, and that's what we actually looked out for in the first cohort. In the first cohort we've tried to socialize. This year we are on in terms of socializing. We noted that there are some limitations in terms of the penetration due to some restrictions on the social media platforms to make sure that campaigns are not done among others, but we are on course to socialize as we did in the first cohort. And in the first cohort, we made sure that there is deeper communication and involvement of all stakeholders. We did have the honorable at the state level beyond what we've done at the national level, at the federal level, the state setting up state screening committees made up of distinguished persons from different sectors. And just to say that for the first cohort, we had at least 350,000 applications. And that we cut down competency-based assessment, and we narrowed down to the top 3 per local government that we now sent to that committee set up by the states to screen. And we made sure, one thing that I want to point out here, colleagues, is we are committed to respecting people's application. The minister, when we hit 128,000 application earlier this year, he called and said, Ashiru, we have to respect everybody's application, all these applicants. When I look at these numbers, I feel these are individuals that are really looking forward to making their lives better. And for this, these are my directives. I don't have a candidate. I will not send you one. Do not collect from anybody. And we set up a system that there is no one person living that can determine the fate of any candidate. And so we want to use this to demonstrate to Nigerians and youth that while there is a lot that is wrong within our country, but there
sorry, doctor, we lost you, I think. Yeah.
No, so I was saying that.
Yeah, all right, yeah.
So while there is a lot that is wrong, but there are also positive strides to make sure that we get it right. So we selected the 774 from that pool of over 350,000, with none of them being referred by anybody. It's purely based on merit. And the fellows, because they came from different disciplines, we took some time to onboard them to begin shaping their thinking so that they can begin to think, act as public health development physicians, so to say. And we now took them through issues of leadership, people's management, public health and service delivery, financial management, problem solving, project management, data analysis, among others. They had some physical trainings at the beginning, and they continue with this asynchronous learning. The minister personally supervised those trainings, and we had Mr. President honor them by inaugurating them, and the minister identified an opportunity, because when we go through during the training, a lot of these young men and women came with their CVs because there is no job anywhere. And when they meet you, the first question is, please, can you help me with job? This is my CV. The minister saw that. They reached out to him. When he saw the president, and he made a passionate appeal to the president that, Mr. President, these young men and women that were selected based on merit had one item, one question in mind. What happens after the fellowship? And Mr. President declared them hired. And we're working as we speak to make sure that we get Mr. President's directive concluded so that we have 774 young Nigerians, sons of, in the language of Nigerians, not to demean anybody, in the language of Nigerians, sons of nobody that knew no one, now hired altruistically based on merit into the Federal Civil Service. Post-inauguration, we send them back to their communities, to their LGAs. They continued their asynchronous learning to deepen their expertise on those subject matter, and then also link them with 156 mentors across the breadth of the country so that they continue to deepen, engage, understand the socio-dynamic issues affecting health in their local government and begin to work towards solving those problems. And of course, with the mentorship, and when they identify those issues, they now do their capstone project that will be their signature that we have come in to this local government. We've identified these challenges, and this is what we've done to help address that. We've attempted also to build their capacity on how to tell their stories, because it's one thing for you to be doing the work. It's another thing to be a positive agent that will turn things around to have positive influence on your community. This is just some of the dashboard that tells you how deeply engaged the fellows were in terms of the modules, the asynchronous learning, the live sessions they have weekly with their subject matter experts to expand and allay additional, to provide additional explanations. And then, of course, the mentorship sessions that they went across the board. For their capstone, all the 774 are now deeply involved in solving one problem or the other in their community. We have around 201, and on the average, each fellow is trying to solve at least 2-3 issues in their local governments. We have over 200 focusing their interventions on improving maternal and neonatal health, over around 250 on community awareness and health education. Around 98 are working towards strengthening the infrastructure of their primary healthcare facilities within their local governments to make sure that they are able to provide the services. Around close to 40 are providing digital solutions to improving health outcomes, either tracking pregnant women to make sure that they attend their antenatal, or doing citizens scorecard that will give real-time feedback to policymakers on the direction and issues and concerns of people. Around 90 doing sanitation, 20 around mental health, and then among others. So these are sort of the work we are expecting these people to do. And as we speak, initially, the timeline for the first cohort will end 30th September, November, but the Honorable Minister had extended their timelines their graduation till February 28th. So they have 3 months additional. But in the interim, the second cohort for the National Health Fellows, the call for application opened on the 1st of November and will close on the 30th of November. I deeply request for all the applicants, for all eligible applicants, young Nigerians that are passionate about making real transformation, to please visit www.healthfellows.ng to apply. If you want to see and get in tune with what some of these young men are doing, men and women, please look on either the social media, follow the hashtag Health Fellows Show of Hand, and you will see the amazing impact these young Nigerians are doing. I would have loved, I think I overestimated how long I would speak, but I would have loved to share a quick video. One of our fellows from Maiduguri, some of what he's doing, but otherwise I can just quickly narrate it, and I will share the videos with you, Mala Umar, to take in. So, for example, that young man from Maiduguri, the starting point, yes, he is an economist. He studied economics, he's doing his master's in economics, but then a pregnant woman lost her life in his community. And he realized, oh, this might just be an additional statistic. So what do we need to do to make sure that we forestall future occurrence? He understood, brought his community together to know what is the problem. And he understood that, yes, they do not have functional primary healthcare facility close to them. They don't have the right access road. And if it's time for referral, they have to now either use Kekenapep also, which might complicate issues. And because he now realized that he is a change agent, and being a change agent, he can't just fold his arm to say, okay, there's nothing I can do. He now went ahead, moved together, collaborated with another health fellow to now go and source a brand new ambulance from the state emergency management system. And to make sure that if that ambulance could pass through his community easily, he had to now undertake another effort, another advocacy to the Commissioner for Works in Maiduguri, in Borno, to now get them to come and clear the access road to his community so that that vehicle can pass easily. It shortens the delivery, the transfer of patients, but also enhances the half-life of that vehicle compared to if that road is very poor, among others. That young man didn't stop there. He had now moved ahead to now secure equipment for 5 primary healthcare facilities within his community. These are the sort of people that we are really raising through the National Health Fellowship Program, and we really look forward to having this to be a transformational point for our health system. And I employ all of you that are interested to please participate and apply. We guarantee you that this is 100% merit-based. If you merit it, you will get it. You don't need to know anybody. Thank you so much for listening to me, and I'm happy to respond to questions and clarifications if needed. Thank you.
Wow, that is really well elaborate. Thank you so much, Dr. Ashiru. It's quite a fascinating program, actually, especially when you broke it down into all those patterns. It's much more clearer, I think, to so many of the people. Before the talk, I received a lot of phone calls and chats, people asking about what the National Health Fellowship Program is all about. What does it do? What do you need as kind of credentials for you to go in and things like that. But having listened to this talk, I think even for me that went to the website, I think it's much more clearer. So thank you so much for that well elaborate presentation. Thank you. So it's time for Q&A session. I don't want to talk too much and take too much of the time summarizing things. I think it's much more clear to us all. So that it's time for us to ask any questions if we have. So the format is gonna be if you want to ask, you can pop your question through the chat box, or you can use the hand raising option of Zoom, and you will be then called to ask your own question. So let me check the chat box and see if we have some questions. I think the first comment there is from Aliyu, who says he's actually a fellow from Ilela local government in Sokoto. So thank you so much for joining. Also, some people are mentioning that they want to actually join the program. So many people having much aspiration to join. So please, if you have any question, pop it into the chat box, or raise your hand and you'll be called to ask your own question. So Dr. Ashiru, I have one question before we start to get questions coming in. If somebody wants to join the program in a nutshell, in a simple explanation, how can somebody do that? If I'm ready, I really want to go in. What are the steps that I need to follow to apply?
Right. So for anybody that wants to just you want to try his luck, just go into www.nationalhealthfellows.ng, www. I hope let me not do the NCDC. So the
So
website is
yeah.
www.nationalhealthfellows. I thought I just mentioned two W's. So just
Yeah.
go to www.nationalhealthfellows.ng.
Okay.
You would see the link to the application. The application form is there. You apply online, and you submit. I think there are a couple of questions that will help to help us determine eligibility. And then, of course, I think one key item is the ACEs. There is a point for the ACEs. The one would be expected to write about his passion, among others, of why he wants to be there. He or she wants to be part of it. And that's it. So you submit. We will screen, and we'll reach out to you as soon as possible. I think I want to just mention something, and depending on if we don't have questions also, I realize that we do have quite a bit of the health fellows here. You may want to call each one of them to ask them what does this mean to them.
All right.
What is the transformation they are getting within the health fellows? For context, I didn't know they will join this meeting. Maybe they saw it and they joined, but I have not invited any of them. But the fact that they are here, as I told you, they are the best brand that we want to present.
That's well elaborate, Dr. Ashiru. Thank you so much. We have some questions coming in, Dr. Ashiru, in the chat box, which we are going to pick up later.
Sorry, Dr. Umar, you are muted. Okay.
Yeah, sorry about that.
I know it's my fault. I was trying to mute others.
Mute everyone. Okay. That's okay. Abba Dahiru Gora, if you are with us, please unmute your mic and ask your question. Abba Dahiru Gora, you raised your hand. Yeah, go ahead, please.
Thank you, sir. I am Engineer Abba Dahiru Gora, Health Fellow representing Modobu local government of Kano State. I have question. My question is that most of our colleagues or people that are trying to make this registration are asking whether those two that we went interview together with them and Allah choose us to be part of the best Chrome being chosen and participating in this program are asking whether those two are going to be considered, or this is just fresh running they have to undertake. Then I am using this medium to thank the president and the minister Prof. Pate and his team. More importantly, the coordinating office of SWAP for giving us this opportunity and renewing our hope. Because before, if I am told this kind of process will be done in Nigeria, I will be the one that say no. But now I witness it, I am part of it, and my hope has been renewed. Even if I am going to find myself in a condition, by the grace of God, I will replicate what has been done to us. Thank you so much.
All right.
Thank you.
Okay.
Thank you so much. But that is a lived experience, from someone that has been in the program, and I'm sure that's what Dr. Ashiru is actually heading for. We can get feedback from the people that have enjoyed the program. Thank you so much. We also have Aishat Sahid. Also, you raised your hand. If you can unmute your mic, please go ahead and ask your question. Aisha Sahid. If you're with us, go ahead and ask your question. I can unmute you from here. Okay. Are you with us, Aishat? Okay, I think Aisha is not there likely. So if you come back, you might then be able to ask your question. So the next person we have that rose the hand is actually Muhammad Adigun. If you are there, please go ahead to ask your question. Muhammad, are you there? Adigun. Okay, so if Muhammad is not there, then Abdul Qadir Idris is the next. Abdul Qadir, if you're with us, please go ahead and ask your question. Unmute yourself and ask your question.
Hello.
Okay. Okay, so everyone put their hands down. So I think it's like they're not asking any longer. So let me go to the chat box, Doctor, and see we have some couple of questions there that we can pick. Let me go up a little bit. Okay, so this is all about aspiration, people wanting to join the program, which is quite nice. So somebody is asking, Doctor, the person said that's Hannatu Kabira. She's actually interested in the program, but she can't conduct the physical screening because she's out of the country at the moment. Is there a way that can be done? Is there any alternative, or do you have to be present for the physical screening?
Okay, so maybe I will just with the first question from Abba, the two semi-finalists should please apply. And there will be, we did have a question about this time around to make sure whether someone has applied last year and he is now reapplying this year, which means there is some additional interest that the person is exhibiting. So hopefully we'll take that, but that is not a guarantee because it's a multifactorial decision that will be put in to make sure that you get it and what have you. And we want to make sure that we maintain that merit-based structure to make sure that we get the very best. So that is it. So they apply, they perfect and update their ACEs and the experience and passion, and we pray that they get it this time around. In terms of the physical interview, it has to be physical. If you want it, you need to be there physically to show yourself, to prove your documents, among others. There's no option for virtual interview. Yeah.
Okay. Thank you so much, Dr. Ashiru.
So,
yeah. The next question is from Kanke Zakaria. If I may read that, it's actually talking about submitting multiple applications. So supposing they made a mistake in the initial one, so not deliberately submitting multiple, but due to a mistake in an initial application.
To be honest, I know I can't tell you yes or no for this one. I know one of the things we battled with last year is multiple applications. And that's why it's always good not to be, I was shocked to see that within 12 hours of the application, we had nearly 12,000 persons submitting. So one would really begin to wonder, have they really sat down to think through the storyline? What is it that truly I want to submit as we move on? The first cohort we saw as we are approaching the last few days, we saw the applications tripling. There is a day that we received over 30,000 applications, meaning these are people that had sat down to really think through and to put in their best foot forward. I know we are trying, and we had nearly 354,000.
Sorry, Doctor, I think you are muted. Yes, Dr. Ashiru, I think we lost you. Sorry, Doctor, if you can hear me, we can't actually hear you. But it seems you are unmuted here.
I think it's his internet.
Yeah, likely, yeah. So let's see if Doctor will maybe rejoin. If you can hear me, maybe you can leave the meeting and rejoin if that's possible. Yeah. So Doctor left. I think he will rejoin. I think it's a very interesting kind of program. Having looked at especially the success of the first round. I think Doctor is back. Go ahead, Doctor, if you can hear me. Dr. Ashiru? Yeah, I think it's network problem likely. Sorry about that. I think Doctor is having some issues with the network on his own side. So let's hope he's able to rectify that and continue with the conversation. We have lots of questions. I think people are so interested in the program.
In the chat box, so.
Yeah, I hope we can be able to answer many of them. We still have some time. Yeah. Yes, I think Doctor is back, if I'm right. Are you with us, Doctor? Dr. Ashiru?
Yes, I'm here.
Yes, thank you. The network, I think, is faulty a little bit. Yeah, so go ahead, please.
Yeah, so I was saying that last year we did have nearly 100,000 duplicates in terms of application, and we're trying to reduce that significantly. So I'm not sure. Kanke, try. If it goes through, good luck. If not, I think we will still get to meet another time. I think someone asked Phillips that what becomes of the fellows after 1 year period of the program. I mentioned that for the first, so fellowships generally are opportunities, short-time period engagements to build your skills so that you are able to, Umar, please confirm you can still hear me.
Yes, we can hear you, Doctor. Go ahead, yeah.
Oh, okay. Fellowships are largely short-term skill building stuff that will help you amass skills that will benefit you in your future. The first cohort, we are lucky, Mr. President said they are hired. We don't know what will happen with the second fellows, but what we are seeing, and I told them this first cohort during the formative review with the coordinating minister, that when you look at the amount of energy and impact that they are making, bringing them into government system, unless we are having a specific program for them to harness that energy, might become
Sorry,
we're
doctor,
really
you're muted.
looking
Yeah,
forward.
go ahead.
Yeah. So we're really looking forward to fellows using the knowledge, skills, contact that they would have now to create a path for themselves. We already have close to 10 that had secured fully funded scholarships outside Nigeria. And some would naturally be targeted by the development partners. So the pathway is enormous. And maybe just to mention, Dr. Umar, myself, of course, I'm a medical doctor, but 12 years ago exactly by now, that's when I finished my first fellowship, Maternal Health Young Champions Fellowship Program. And that opened the endless doors of possibilities. It's then that I truly know who I am as a person. What change can I bring to my community and to people that when I sit across the table with different people, how do I engage? How do I build trust? How do I make sure that I carry people's challenges and concerns forward to make sure that we are solving that problem? And as God will have it, 12 years after, I'm now at the center of creating many more of my kind. And I look forward to be hoping that they are better and more successful than I am. The minister, at the point when we're having this initial conversation on the Health Fellows program, said when he reflects on what the Health Fellowship will do, he looks forward to 15 years from now when someone sitting in his office in Geneva or New York or Hamburg or whatever will now reflect back to this moment and said, you know what, my career started as National Health Fellow. So he's really looking forward to it as a stepping stone to greater heights for young Nigerians that otherwise do not have the wings to fly, so to say. So maybe we can take further questions from the
Yes, doctor. Thank you so much. This is
chat
really
box.
brilliant and
Back to you,
inspiring. Yes, thank you, Dr. Ashiru. You cut a little bit, but I was just saying that this is really inspiring. Yeah, go ahead.
So I'll say that Dauda is, I'm actually just reading through the chat box.
Yes, go ahead. Yeah, please. Yeah.
And so Dauda is asking, he has a degree in microbiology, if he can apply. Absolutely, please go ahead, apply. Do not hesitate. Techno BF7, please go to www.healthfellows.ng to begin your application. Feedback. So for the first cohort, because we are pressed for time, from the beginning of the application to the time when they were invited for interviews, the final selection, 8 weeks. We started the application. The application was opened 16th January, and by 6th March, Mr. President had already inaugurated them. So they've gone through all this within a short period of time. For this, we have timelines that November will be for application. Between December, January will be for the review, screening, and finalization. So by end of January, we should have our finalists, the 774 health fellows, one per local government, and we hope by first or second week of February, we should have them, and hopefully before Ramadan, Mr. President, we are hoping to block Mr. President calendar to inaugurate them. So literally a span of about 3 months from now, we should be done.
Sorry, Doctor, the voice is cutting. Okay, yeah, I can hear you now. Yeah.
Okay. Sahidat is saying, is it compulsory to be 25 years before I can? So I cannot guarantee, but if you feel you have what it takes and you are below 25, but you have a compelling reason that why you should be choosing apply for it. Let's see what happens. Can someone who study animal science see eligible? Apply, Ibrahim Lefagana. Please apply whether animal science. So we said health related, and sciences, social sciences, and what have you. So please go ahead and apply. What is the time duration for start to finish of the fellowship? So health fellows will largely from February to November, December. So about 10 months or so. That's the expected duration. So, but for the first cohort, they are now staying 1 year. And there is possibility of us just routinizing it to be a 1 year period from March to February. Okay, Clement said he is here to encourage the applicants. Clement, if you have some time.
Yes, I'm here.
I'll give you a minute to say something. Appointment. The Health Fellowship Program, the National Health Fellowship Program is an opportunity to build your capacity so that no, Clement will come to you later. Ajana, the National Health Fellowship Program is an opportunity to build your capacity so that
Sorry, Doctor, we we lost you there. I think I can't hear you. I don't know if Chutiemi, can you hear, Doctor?
You are useful to yourself and your value.
All right,
to
okay,
the
go ahead. Yeah.
But if the permanent and pensionable appointment promise anyone, the first set, Mr. President had pronounced those, we can't say for the second set. National diploma will not. If you have HND, technical Spark HP, if you have HND, that is what is equivalent to a degree. You can't. National diploma is not. It's not applicable. Employed working government or departmental healthcare are going to be considered, and is there any age limit? Please go to the. Thank you, Leslie, for responding to that. How can one know he has been selected? For anybody that had moved to the next level, we will contact them. And in fact, we are even making this system even better so that you yourself, once you apply, you can be able to track your progress, what have you. So, but all that would come later. Why are only degrees holder iPhone? So, some of these successful but didn't get it, so we really appreciate you are successful this time around. How should our CV look like? Standard CV should be fine, but you have to be real with yourself because we go extra mile to verify what people said they have achieved in their CV. Last year, I mean, this first set, this first set, there are individuals that we disqualified because we disqualified them because they impersonate and they got us wrong information. So we disqualified them. And this year we are going to even deepen that. Can they apply? If you apply last year, you didn't get it, please go on and apply again. Hajara Adebayo is here to issue a diploma. You need to have your NYSC certificate at the very least by the time when your interviews will be made. If your NYSC certificate is not available, if you don't have your NYSC certificate, then it's almost unlikely. If you are exempted for your NYSC, put in your exemption certificate as your proof, and that should suffice for you. Umar, back to you.
Thank you so much, Doctor. We have lots of questions, I think, still in the chat box, but unfortunately we can't take all of them. Is there maybe an email, Doctor, that people can contact you and ask question, or maybe contact through the website, I think, so people can be able to have their own questions answered in the maybe subsequently?
Yes, so we have an email. So we have email. I'll drop the email here, info@healthfellows.ng. If you need any question about this, so Ahmed Ibrahim, thank you. He's saying he wants to urge applicants not to lobby anyone for selection as National Health Fellow is 100% based on merit. So we do have 8 minutes, Umar.
Yes, yeah.
At the prerogative, you may decide to honor some of the health fellows, the first cohort, maybe a minute each to say to just add some points here, and then we'll wrap up. Thank you.
Exactly, Doctor. I think that is quite interesting. I can see from the list of participants, Hajara Adebayo is here. I think Hajara, you're also one of the fellows. Do you want to come up and say something? Then, if you are a fellow and want to talk, 1 minute, please, each. So raise up your hand, and I'll call you each to talk to us about the program. Go ahead, please, Hajara.
Good evening, sir.
Good evening, Hajara.
The National Health Fellow representing Kontagora Local Government of Niger State. I would like to stand on the existing protocol because of the time. So I just want to encourage the incoming fellows that this particular program is based on merit. There is nothing like I know somebody or someone. The way we're being selected, we're children of nobody, and we met ourselves in the higher places today. As for me, during the interview, I want to cite an example based on my experience during the interview. The interview started at the gate for me because the person that interviewed me that very day, one of the panelists that interviewed me that very day, was at the gate as I was entering. So he chatted with me, we're discussing, not even know that he was one of the panelists. I was even telling him that the time has passed, the time that they said we'll come for the interview. Unfortunately for me, when I was called in for the interview, he was there as the panelist. So he told me that my interview starts at the gate. So I didn't mean I've misbehaved, which means I'll be out of it. So meaning this particular program is based on merit. Another thing that I want to say is that this program has exposed me to a lot of things. It has built a lot of capacities in me. I've been able to engage with a lot of people that I did not even deem it that I will meet in my life. One of it is I've been able to, during my capstone project, I've been able to meet with, I engaged in dual capstone project, which is revitalization of the PHC that has even been named Asibitimbola. But as I speak with you today, it has been renovated, and I've even engaged with UNICEF, they have even promised to equip the facility with modern equipment. A full container of modern equipment has been approved for the facility. Another this thing that I did was I tried to collaborate with an NGO on fistula, and that is the Rice Foundation. And with that, we've been able to treat and at least reintegrate most of the women that are suffering with fistula, at least almost 50 of them. So I just want to encourage every other person that is interested in this program, just go for it, and you will see that it will transform your life. I didn't know that I can be transformed like this, but at least as time goes on, I've been exposed to a lot of things I've been exposed to a lot of programs outside the country. So just go for it.
Thank you so much, Hajara. It
will be fine. Thank you, sir.
Thank you so much, Hajara. That is really inspiring for me as well, and for many people that are listening, I'm sure. Thank you so much. So the next person on the list is Immaculate. If you're with us, if you're a fellow, please unmute your mic and give us your contribution. 1 minute, please, Immaculate. I think Immaculate is not there any longer. So we have Clement. Please come in if you are here.
Good evening. Actually, I was trying
Immaculate. Okay, go ahead.
Oh, so Immaculate. a National Health Fellow representing Bomani local government in Delta State. Added to the fact that the program is merit-based, I would love to say, I think if you are selected as a fellow, for me, the most important thing is to have an open mind to learn more. Like other fellows has mentioned, it will give a lot of opportunity to meet people and knowledge that you never knew was accessible to you. So the basic thing is when you are open to those rooms, when you walk into the room, go in with it, not with the idea or with the mindset to learn, and you gain a lot. Thank you.
Thank you so much, Immaculate. That's really precise and on time. The next person on the list is Ashiru Gora. Please go ahead and give us your contribution. 1 minute, please. Hello. Go ahead.
Back again. Permit me to continue with the existing protocol. And what I will encourage the incoming fellows is that the way this program is merit-based, please, when given this opportunity, Mr. Minister asked us when we are going in synchronous training in Abuja that what do you want to do with this opportunity? So I will always think that question. This fellowship is a key. It will unlock many doors for you. And I encourage you that after giving this opportunity, please be true to yourself and give back to your community, because the purpose of this project is that to touch the grassroots problem, more especially in the health sector. Now, I am engineer by profession, mechanical engineer. By that, I am working with another company before this fellowship. Due to the time, I resigned with this company just to give back to my community, because this fellowship has exposed me. They fed almost everything we are going or we are doing. See no reason why someone will just say, let me grab the opportunity and just hold it without giving back to his community. We have to be true to ourselves. Thank you.
Thank you so much, Abba. Thank you. I think we're going to take the last person, Nasir Usman Kasim. Are you with us? Go ahead, please.
Thank you very much, sir. I'm Nasir Umar Kasim, the National Health Fellow representing Kumboso local government of Kano State. What I want to add with the prospective fellows is you have to pray hard. In as much as the application process is merit-based, you need to pray hard. Like, it's worth praying for. In as whatever you believe in, whatever path you are following, just pray hard for you to get it. If you get it, then your story will start. Thank you very much.
Thank you so much, Nasir. Umar, we still have a few seconds. Doctor, I don't know if you want to give a quick closing remark before we round up. Doctor, are you with me? If you want to give a quick closing remark so we can then call it a day. Dr. Ashiru, please go ahead.
So thank you so much, Dr. Umar, for inviting me to have this conversation. For us, the fellows mentioned, the minister asked them, what do you do with the opportunity if it's given to you? And they answered resoundingly that you seize it, you grab it. If you are a young man or woman within the age range and you are passionate about making difference in your community, I please urge you, do not hesitate. Start your application now and tell the next person. Be sure that we will respect you. We will honor our solemn oath to protect your application and make sure that nobody would come from another with recommendation of because he's somebody, he knows somebody, for us to consider their application ahead of yours. All of you will be given equal opportunity, and we pray that may the best win. And please, for health fellows here, we will reach out to you, but importantly, spread the word. You cannot do it alone. If you are making transformational impact in your local government as a person, if you have another person, a supporter that you can now work with, it makes it even better for you, and the more number of you committed, altruistically motivated young Nigerians that we have that want to bring and catalyze change, the better our community is. So thank you so much for this time, and we look forward to hosting the successful applicants in Abuja in February 2026, inshallah.
Thank you so much, Dr. Ashiru Adamu Abubakar. We are really delighted to have you, and it's really inspiring. And I'm sure we all learned a lot. Because of time, I think we're already 2 minutes beyond time. So on behalf of Gamji Educational and Mentorship Forum, I will like to thank you all for your time, and till we see you next in our future seminars or presentation. So thank you for your time, and have a good night all. Bye.